Once again, thank you for tuning in to another broadcast of Eye on the Community. I'm your host, Sean Anthony. Up next, I'm joined by three individuals here who is a part of Ohio's COVID care program managed by the Alcohol, Drug, and Mental Health Board of Franklin County, also known as ADAMH. First, let's break this down. And Teresa, we'll start with you, Ms. Teresa Lauderdale. Give us a brief introduction of who you are and what provider agency you work with.
Well, I'm Teresa Lauderdale, and I work for National Church Residences. I'm their peer support supervisor, and I oversee the CCP program.
Okay, well, welcome, Teresa. Ms. Denise Martin, can you do a brief introduction of yourself as well and the provider agency you work with?
Sure. My name is Denise Martin, and I work with Ethiopian Tewahedo Social Services. I'm the Crisis Counseling Program Supervisor.
Interesting. Gail Stone, please, brief introduction with you as well.
My name is Gail Stone, and I am with Community for New Direction. We offer mental health services to adults, and I too am the Crisis Counseling Program Team Supervisor.
Gail, let's start with you. Let's talk a little bit more in depth. What unique programming or outreach efforts have been implemented as a result of Ohio's COVID care program?
Our COVID care program here, we have had some great strides that we've made here in the immediate King Lincoln district. And my team has been very, very eager and very outgoing. We were able to put together something called a Chat Buddy program. That was also a recommendation within the CCP program, but we've tweaked it just a little bit to include seniors. We are charged within our grant to pursue the African American community and Latino communities. We extended out to the seniors because they too would be experience some isolation issues that would be extended because of COVID. So as our COVID team, we went out and pursued an agency that had a seniors program. So we call them once a week, every Tuesday at 11. And we are able to connect with the seniors in our area and give them an opportunity to share out. Sometimes when the isolation is already there because they're seniors and they may not have family and friends who reach out to them or to whom they can reach out to. So our team has been able to make these great connections here in the area and give our seniors an opportunity to be heard and to share ideas. We have a different theme every week, and it's been very successful. Additionally, we have come up with something called our COVID safety kit, which includes our marketing material, our postcard that has our hotline number, hand sanitizer, and 4 safety masks, and information on Community for New Direction as well, so that anyone who needs mental health services could come into the office and probably get an appointment within a day or two.
Excellent. Thank you for that information, Gail. Ms. Denise Martin, can you elaborate a little bit on your outreach efforts and how they have been implemented as a result of Ohio's COVID care program?
Sure. ADAMH recognized that people of color, new Americans, refugees, and immigrants were disproportionately affected by COVID. So what they did, they supplied us with a grant, and they recognized that it was beyond behavioral health needs. People need help with food, rent, basic needs. So we were able to help with that. But the main thing for our program, Sean, culturally and linguistically appropriate services. Our counselors, Claver, Fardos, Navy, and Nirmala, are for the communities that are our priority populations. So they are well respected in their communities, they are well known, and that has been a great bridge for us to reach those communities. In addition, we utilize social media. We have a self-care Wednesday post every Wednesday. This Wednesday, we're focusing on the word self-care in multiple languages. We also have created videos and flyers with the help of ADAMH in multiple languages to share with our communities. And we go wherever. We'll go to a grocery store, we'll go to a senior center, we will go wherever our clients need us. So those are our unique outreach efforts.
Excellent. Thank you, Denise. That's very informative. Teresa Lauderdale, Can you share with us your outreach efforts with your program?
Yes, our outreach efforts allowed our counselors to connect with several National Church Residences agencies. We're known for our senior program, but we also have a PSH department, which is Permanent Supportive Housing Department. So when this program launched, we targeted those within the buildings which we work, and then we expanded out to our seniors. We use flyers, door hangers, and the such to give to our residents that have our phone number on it, and it explains to them some of the services that we offer. One of the big things that we offer is the counseling piece itself. And so we want them to know that that's available. Our residents were once homeless and now they're living in subsidized housing, and we wanted to make sure that they didn't feel alone. You know, everyone felt alone and they felt isolated. And so we were able to make sure we presented some material to them, but we did not stick with inside our community itself, as we reached out to metropolitan libraries, including as many different branches as we could reach, such as the Livingston and Barnett branch, which is in a community that's poverty-stricken, the downtown branch, the Driving Park branch, the Franklin Park branch, the Martin Luther King branch. We also provided resources to Marion Franklin Senior Recreation Center, as well as the unemployment offices. We connected with the juvenile detention branch, who said that the juvenile detention center, who said that they would make sure that our resources got in the hands of families. We wanted to make sure that families have available the services that are needed to meet their everyday needs. And we were also able to connect with the municipal courthouse to provide resources on their 6th floor in their resource center. So we're trying to make sure that the community as a whole are aware that we are here to help meet their needs.
Excellent. Ms. Teresa, while I have you, can you talk about how you feel that crisis counselors have made a difference in the community?
Oh, they have made a huge difference. There are several different aspects. I know that bringing counselors aboard itself was an impact. People were suffering from job loss. We were able to hire 8 new employees and bring them aboard. So we were able to employ them. Again, we worked in an area where people suffer from mental health, and we watched them plummet. We watched their mental health plummet, and people were being hospitalized left and right. They felt isolated. They felt alone. The counselors came aboard, and their impact could be seen. We watched people who were struggling mentally finally become alive again, become connected to someone again. And as they express the value of just having someone to talk to, having someone to put those resources in their hands, you know, we watch people really get their lives back. And to be able to have people calling in, we answer the 24/7 hotline and have them calling in, and they need resources. They need to know how can they pay their rent. They need to know how can they pay their utilities. And we're able to connect them with a valuable resource who can meet their need, and to follow up and they hear them say that their needs were met. So we know that we actually help people stay in their homes. You know, we help people keep food on the table.
That's excellent. Ms. Gail Stone, would you like to add on to that? How do you feel that crisis counselors have made a difference in the community?
Our crisis counselors have been out to canvass, just like the other 2 teams. We spend our time canvassing the community. We go to strip malls, the recreation centers, local churches, and food pantries. When we're at the food pantry, we're not only there to volunteer to help create those food boxes that are greatly needed in our communities, but we also make sure that our hotline flyers are included in each one. We've been out to the Hilliard branch with the Hilliard Food Pantry. We've also been here in the over at St. Stephen's, and we're planning to go out this week to the Clintonville area to share our information there as well. Many of the churches that we've visited were very happy to be able to get that information so that they can share about the hotline. We don't want people to feel like they're alone. The mandate to have us inside has created just a huge mental health issue, not only here in Franklin County, but across the United States. So this program has been amazing, and being able to just have the conversation. Sometimes people just need to be heard. And on that hotline call, we have found many times that people didn't have an overwhelming need for anything huge, but they did have a need to be heard. They're inside with their families. They don't have the answers to all the questions and concerns that their family members have. And just being able to talk to another adult or someone else has been a real service. So we're making sure that here inside our building, we have a message board. The message board, we print out those statistics from the CDC that share about how many hospitalizations there have been, how many deaths there have been due to COVID, how many people were reported and tested with COVID, so that we know that this is still a real virus and this virus is still out there and it is still very present. And we should not give up on making sure that we are safe, that our loved ones are safe, and that we are safe as we move around in our community here with COVID. So our crisis counselors go out and we meet with people face to face. We still social distance, but we are still there to help them have that conversation. We've been in barbershops, and we can call that a small group for our reporting structure. But the opportunity to share and to hear other people and just have them go back and forth on those ideas. We've done it on bus stops. Folks are just kind of hanging out on the bus stop. They just need to be outside or be away. And we had conversations about the vaccination. We had conversations about how COVID has affected them. So our team is just out there to have the conversation, not only to share what resources and linkages are available here in Franklin County, which there are very, very many, but my team is really actively involved in talking with people one-on-one.
Gail, what would you say the impact has COVID care program had on the crisis counselors doing their work?
My team has grown a lot. I tell them every time they come back, numerous times I've said, you guys are making history. This will be an awesome story for you to share in the coming years as we are praying that this COVID gets under control. But on them, they feel useful. They feel like they're part of the solution for COVID-19 and not just being affected by it, but they can go out and help in the community, and it's helping them. They're feeling the growth. They come back charged and rejuvenated from being out in the heat and hanging door tags and handing out flyers. My team is then just invigorated when they come back, and they have great stories to share. At one instance, they were in a bank, and a woman walked in and did not have her mask, but she needed to do her transactions. The bank didn't have masks, and unfortunately, we didn't either. But that prompted us to create our safety kit. And I said, that will not happen again. If anyone ever needs a mask, hand sanitizer, etc., we will have it in this kit. And it will be available as we're out sharing and engaging. We'll just have it readily available to distribute as people need them.
Ms. Denise,
so my team is charged and invigorated by this whole experience, and happy to be a part of the solution for COVID-19.
Excellent. Excuse me for interrupting. Ms. Denise, I wanted to direct this question to you as well about the impact has Ohio's COVID care program had on crisis managers, counselors doing their work?
Yes, what COVID did, I attended a training, Sean. It was a CDC training, and the most powerful statement I heard was, COVID peeled back reality. So when you think about existing disparities or inequities, COVID peeled that back. So for our counselors are connecting, and they are the bridge with language barriers that are existing. And our counselors, I can't say enough, and I'll say their name again, Claver, Fardos, Nabi, and Ramallah. Amongst all of us, we speak more than 10 languages. And so our outreach, we're able to reach people that may not get help, especially on that net care line, which is 614-278-0190. ADAMH collaborated with Netcare, and we are the 3 providers that will receive calls for the Ohio's COVID care program. And it's changed me. ETSS, we work and we have multiple departments. We have an employment. So if someone calls, or if we know of a client that needs help with employment, we can take them to a culturally and linguistically appropriate employment counselor. We also have a domestic violence program. We have a youth program that we have collaborated with. multiple presentations, because we do know that our youth are also having effects of COVID-19. And so the counselors tell me that they are so excited when they share stories about how we are able to help in a culturally and linguistically appropriate way.
Excellent. Well, ladies, I definitely appreciate your time and sharing this information to our listeners. Last question. How can someone get connected to services through Ohio's COVID care program? I know, Denise, you mentioned a number just
Mhm.
moments ago, but can anyone provide that information to our listeners?
Well, we know that COVID-19 impacts more than just your health. We can get you connected to food pantries, financial help, and other health resources by calling our 24/7 hotline. Again, that phone number is 614-278-0190.
Excellent. Teresa Lauderdale, Gail Stone, Denise Martin, thank you once again for providing information about the Ohio's COVID care program. You ladies have a wonderful day.
You too.
You do
Thank
the
you for your
same.
All right.
Thank you.